Hello guys, today our topic is calcification. Calcification is the deposition of calcium with small amount of other minerals. It is of two types, dystrophic calcification and metastatic calcification. First we will discuss dystrophic calcification. First point about the dystrophic calcification is that it is seen in dead tissue. It means that the deposition of calcium will be in dead tissue. We know that when tissue is dead, metabolism of calcium not occur. So when there is no metabolism of calcium in the dystrophic calcification, there will be no abnormality of calcium metabolism. And if we see the calcium level in the serum, the calcium level will be normal because there will be no metabolism of calcium. Remember that calcium appear as densely basophilic on H and E stain. And example of dystrophic calcification are mnemonic for this is rat plus soma bodies, rheumatic heart diseases, atheromatous plug and TB lymph node plus soma bodies. These are the example of dystrophic calcification. What is samoma bodies? Samoma bodies are round microscopic calcification of calcium. It is just like this round microscopic calcification of calcium. Number two, metastatic calcification. The first difference between the dystrophic calcification and metastatic calcification is that it is occur in living tissues. And when tissue is live, we know calcium metabolism will occur. When calcium metabolism occur, there will be abnormality in calcium metabolism here. So if we see the patient serum level, it will high because this type of calcification mostly seen in hypercalcemia. In hypercalcemia, we see metastatic calcification. Examples of metastatic calcification are sarcoidosis, vitamin D disorders, parathyroid disorders, and bone disease. In these all diseases, metastatic calcification is present. Now there are some important points about calcification that we should know. Number first is that calcification is begin in mitochondria. Number second, apoptosis, reversible cell injury and calcification, these are start in mitochondria. Kidney is exceptional case. In kidney calcification begins in basement membrane. Special stain that we use for calcium is number first one COSA stain and number second alizarin red S. Remember on one COSA stain calcium seen black and on alizarin red S stain calcium seen is seen as red orange in color. Now pigments. What are pigments? Pigments are color substances and it is of two types, exogenous pigment and endogenous pigment. First we will discuss exogenous pigments. It is those pigments which are secreted outside the body. It is of two types, tattoos and anthracosis. Anthracosis is the deposition of carbon. When carbon because of pollution is ingested by pulmonary alveolar macrophages, it is deposited inside lungs and appear as black. Remember that the most common exogenous pigment is carbon. Number second one is endogenous pigment. These are those pigments which are synthesized within our body. There are three examples of endogenous pigments: lipofuscin, hemochromatosis, and melanin. First, we will discuss lipofuscin. It is produced by lipid peroxidation of membrane. Lipid peroxidation of membrane. Remember, when free radical comes, it takes lipid peroxidation is the process in which free radical come and takes electron from the lipids of the membrane and damage the membrane, and from these the lipofuscin is formed. It is also called aging or wear and tear pigment. It is called aging pigment because as we age, more free radical injury will occur. So more lipofuscin will produce because free radical will come and will take electron from the lipid membrane and will produce the lipofuscin. Remember that it is a sign of free radical injury and the color of lipofuscin is brown. Number second one is hemocydrin. It is deposited in condition of iron overload, for example hemochromatosis. The color of this pigment is golden yellow or brown. Remember that to differentiate between hemocydrin and lipofuscin, because both are brown, we will see the history. If there is aging, it will be lipofuscin. If there is iron overload, it will be hemocydrin. The stain that we use for the hemocydrin is pulse reaction or Prussian blue. Remember that hemocydrin is also responsible for the pigmentation of varicose veins. The last pigment is melanin. Melanin is derived from Greek word melan, which means black. The color of melanin is brown black. And remember that it is derived from tyrosine amino acid. The special stent that we use for the melanin is Dupa reaction. The function of melanin is that it is synthesized by melanocyte and act as a screen against harmful UV radiation. Remember the marker that we use to diagnose melanin are HMB45, melan A and S100. As we discussed that melanin is synthesized by melanocytes. Melanocytes are present over the skin, and when harmful UV radiation strike on skin, melanocytes start producing melanin and it protect the skin from the harmful UV radiation. So if you are new to our channel, please subscribe